So, I'm going to talk about gastroesophageal reflux disease. And first of all, I have to tell the story about this disease, yes. As you can see here, it's something about... as you can see here, it's about the stomach, yes, and also the esophagus. Esophagus here, and we have the stomach. So the problem is actually here, in this area. Here you see the fundus of the gaster. Esophagus is here, and this is a closing mechanism. So, here in this area, we are producing acid fluid. And the mucosa here in this area is very strong and will have no harm due to this acid fluid. But the problem in this area is quite different. The mucosa here is very thin. So, the action here of this acidity, this fluid, is very unhappy for this area. So therefore we have this mechanical closing mechanism here. And sometimes it's not functioning. If you look here, on this picture here, we can see acidity is coming upwards and provoking this area here. And the patient has heartburn, chest pain, dysphagia, and even acid taste in the mouth. This is the closing mechanism. We are calling it LOS, lower esophageal sphincter. That's the normal use of the name here. We can see this is the entrance to the stomach, and it's closed. And this last part of it is mucosa. So it's important to have a good quality of the mucosa. This is a girl of 8 years old. Look here, there's no mucosa here. Acidity has come into this area, and we have an inflammation. And of course, this girl will have a lot of problems. So, the mechanism of action here is actually, the question is this a lower sphincter? Or is it something else? What we found out in our research is this is not a sphincter. No. It's like this. This is from Germany. A German anatomist has found out that this is something else. This is a torsion mechanism. So if it's a torsion mechanism, depending on tension in this area, that shows at or gives us the idea that we can have an influence in this area on a mechanical way. And that is what I'm going to show you. So this is actually the problem here. So can I increase the tension and the torsion in this area? If I can do that, no fluid will come up in this area. We have many techniques for that. This is just one of the techniques. And now I will show you the study. It has been performed by also some of my students here, Erik Fosse, Terje Skauik, and Øystein Myklebust. I was leading the project, and I was supervised by Stig Larsen and Ola Reiertsen, both a professor in medical professors. So the aim of this study was to compare the effect of osteopathic manual therapy on GERD, Gastroesophageal Reflux Syndrome, against placebo in a randomized double-blinded manner. The material consisted of 58 GERD patients with a mean age of 50.1 years, and the body mass index 26.1. Duration of symptoms, 10.7 years, and duration of antacids used, 76.2 months. A total of 26 males and 18 females were allocated to OMT, 8 males and 6 females to placebo treatment. So, what kind of methods did we use? The study was performed as a randomized double observer blinded multicenter trial with stratified parallel group design. Patients were allocated 3:1 to OMT or placebo within each strata by block randomization with fixed block size of 8. And OMT, the techniques included tractionocardia, mobilization of diaphragm, and thoracic spine and posture correction once per week. And the controls, of course. The controls were treated with a non-active laser pen on the lowest level on the epigastric area weekly in 10 minutes. 3 treatments with 1-week intervals used for both groups. The degree of GERD symptoms was recorded by the patient on 10 centimeter visual analog scale. Duration of symptoms, provocation factors, and use of anti-reflux medication recorded by the patients themselves. And examinations were performed by the same external and blinded osteopaths before start of the first and 1 week after the treatment. So, now finally the results. The 2 treatment groups were found clinically equal regarding to 5 GERD symptoms and the sum of symptoms before start. And the OMT group, all the symptoms and the sum was significantly reduced 1 week after the last treatment. Reduction detected also in the control group, but not significantly. Reduction in 4 GERD symptoms and in some was significantly in favor of OMT. And the further results was 4 patients were symptoms-free 1 week after the end of treatment, not using drugs. 3.4% reported at least 75% reduction in symptoms degree, in some of degree of symptoms. And 75 reported at least 50% reduction in OMT group. Acid taste in mouth and heartburn explains 81% of the variation in reduced some degree of symptoms. So, the median time of pain release before treatment was 1.5 hours in both groups. This was reduced to 0.5 hours in the OMT, but unchanged in the control group after treatment. Unchanged, really. And the difference in time to pain release was found significantly shorter in OMT. 4 patients stopped using proton pump inhibitors as a PPI. 1 stopped using H2 treatment, and 4 the antacids medication in OMT. The use of anti-reflux medication was unchanged in the control group. So, the conclusion, actually, OMT has a significant effect on GERD symptoms and might be an alternative in treatment of reflux esophagitis. And it might be that this pharmacy industry is not happy for this. Thank you very much.